schizophrenia. There was a recent review, actually, which concluded that child abuse is a causal factor for psychosis and schizophrenia, and more specifically for hallucinations, particularly voices, commenting, and comment hallucination. So the association, see that is there with, if you have been traumatized, one of the responses is dissociation, and that actually acoustic hallucinations constitute a specific form of dissociation. And I was not aware, to be honest, of that before. And I think what it shows is actually that we have a tendency to work in silos, that, for example, schizophrenia researcher meet with schizophrenia researcher and do their specific thing, and the same for bipolar disorder. And it sometimes is very helpful to do a step back and look at issues from a broader sense. So it seems to be that traumatization seems to be a very unspecific factor. And the interesting thing is actually that researchers normally, when it comes to unspecific factors, they are disappointed. They want to have specific factors. But if you look at the issue of concurrent disorders, I do think that these unspecific factors are actually the more important factors, and that is why we want to focus on them. We also looked at other factors, like this is set up a little bit different. I have to apologize for that. But again, with suicide attempt, that is also known. We also found association with ADHD and with eating disorder. When we looked in the literature, has anybody else looked at the more, so to say, epidemiological, population-based approach? There was a study done by Ron Kessler, the National Comorbidity Study, and they looked at a representative sample of the US. They had a final sample of more than 8,000, and they've looked at sexual abuse and found that 13% in the general population and 2% of the males reported sexual abuse, which I found to be quite high. And they actually report the same association. They found an association in red, increased risk, and the odds ratio is significant. They found an association with drug dependence. They found an association with depression. And actually they found a high, significant association with mania. They did not report on males simply because the number of males was not big enough to do an assessment. What it indicates is actually that he had 8,000 people, but he had a low number of those who had abuse history. And actually bipolar disorder is also in the general population about 2 to 3% the most who report having bipolar disorder. And what it also shows you that our sample was much smaller, but we, so to say, had from a psychopathology point of view a highly enriched sample. And he did not report on schizophrenia because the prevalence of schizophrenia is even lower than mania. And so he's simply not able to test this hypothesis with his 8,000 people because the prevalences are too low. And PTSD, again, highly associated. So this is a focus on actually the time, the postnatal or the early childhood phase, when there has been a lot of findings and a lot of attention recently to the fact that these postnatal stress seems to have a big impact on the life of those who are exposed. And also Michael Meany's study, I think it has been mentioned twice in the conference, which was a very nice demonstration that the behavioral effect of changed mothering did have a neurobiological effect of lower levels of GR expression, and again led to a behavior change which kind of transmitted the behavior of the mother to the pup. But actually, persons exposed to postnatal stress are often already exposed also to prenatal stress. And we have heard some of it in a study Rachita presented. And actually, there is different substances do have an impact. And what is reported over and over again is that it doesn't have impact on cognition. I will come to that back later. When we looked at stress in adults, what has been reported is actually that child abuse sensitizes the circuits of adult stressor. So if you have no stress, you have a normal stress activation. If you have mild stress, that even is positive for your development. But if you have a traumatic stress, childhood abuse, what is indicated here, it leads to MDD and anxiety disorders. I would say it leads also to all other disorders, and there has been a focus on major depressive disorders and anxiety disorders, one reason being because it's more prevalent, and those researchers have been focusing on things like HBXs for a longer time. We already heard also today that, no, it was actually later on, your presentation was on Tuesday, that there's an interchangeability of stress and stimulants in sensitization. A lot of attention has been that stress exposure increases stimulants vulnerability, and actually a little bit less has been, research has been done on the effect of stimulants exposure to the sensitization of stress vulnerability. And actually this is a study by Tony Phillips showing that stimulants exposure increases stress vulnerability. So we have a both-way factor that if you have increased stress vulnerability, you're more likely to use substances like stimulants. And if you use stimulants, that also seems to increase stress vulnerability, even though this association has not been studied as well as the other one. So what effect does stress have? And Arnstein very nicely summarized an effect which I think is important. The prefrontal cortex observes conscious decision-making and can be thought as a reflective system. And the prefrontal cortex is the brain region most sensitive to detrimental effects of stress exposure. And mild, if uncontrollable stress can cause traumatic loss of cognitive abilities, and prolonged stress exposure causes architectural changes in prefrontal dendrites. And what she's kind of showing here is that, the prefrontal cortex is responsible for reality testing, top-down guidance of attention, inhibition, regulation of emotion. And if stress sets in, what you have is a loss of the prefrontal regulation, and more like impulsive or affective responses take over. So this also has been shown by other researchers, dividing the brain, so to say, in a reflective system and an impulsive system. So when we have a sensitization of the stress system, what it actually could mean is that we have a shutdown of the prefrontal cortex more faster, which means that it leads to impulsive responses. I skipped over stress in adolescent. It's actually an interesting period because during the adolescent period, you have a disassociated development between the limbic region and the prefrontal cortex. That means at around age, let's say, 16 to 22 or so, the prefrontal cortex is still developing while the limbic system is already developed. What this may mean is that is a period of increased vulnerability. It's just a period where the adolescents start using and kind of start all these processes which later on are perpetuated, like increased stress vulnerability and increased sensitivity